Integrated Pain Solutions is a practice that wants you to maintain your active life, despite what may feel maybe like a life-altering injury or pain. They offer patient-centered care and relief from that chronic pain. So here to explain their philosophy a bit more, I'm always happy to have Dr. David Walega with Integrated Pain Solutions, the sponsor of this segment with me. Good to see you again.
Likewise, Robin, nice to see you again.
Let's talk first and foremost, Doctor, kind of about the guiding principle, the guiding philosophies of your practice. What is it that you really set out to do?
Yeah, what we're really setting out to do is to change patients' lives for the better. And so, chronic pain is one of the #1 reasons people seek medical attention. And it's also one of the main reasons that people aren't able to achieve their lifetime goals of getting out and exercising and doing all the fun things like going to Niagara Falls for the weekend.
Right.
It's so much fun. So, unfortunately, with a lot of chronic pain conditions, people start to normalize what isn't normal, which is, I can't. It hurts too much. I'm stiff. Maybe tomorrow. I don't want to see my friends for an activity. I don't want to go to the soccer match. I don't want to try to exercise. And so it's really important that those patients, really take a hard look at their activity level, their activity tolerance, and seek medical attention when their activities and their lifestyle are significantly impaired by their pain condition.
Yeah, when they are suffering, everyone around them is suffering essentially because they're not able to be their best selves.
Exactly.
And I like that you say no one is a lost cause, because I think that resonates with people who have had multiple treatments, who have gone through, maybe years of physical therapy, of surgeries, of things that they feel like didn't maybe work, and they don't think there's another option.
Yeah. So one of the really exciting things about this particular area of medicine is there are a lot of new and effective things that have come out that have proven to be effective in randomized clinical trials with big numbers of patients. And there are safe new options that patients may not have heard about before. But I do empathize with patients who feel like, well, I've tried A, B, and C. I've tried this medicine. I've seen this doctor, and they sent me here, and I'm still not any better. I do feel like it's always a time for a fresh start and get a fresh evaluation with a specialist and see what your options are and become educated about what those options are, what the potential benefits could be, what the potential risks could be, and then make a decision with your family and your provider about what's going to be best for you.
And you do also say there's a lot of benefits, there's a lot of success for conservative treatments, for minimally invasive treatments. And so that is, it's not always, hey, let's get you in and cut open, some part of you, which is also a scary thought for people.
Absolutely, absolutely. Minimally invasive is really the term of the millennia, which is, less is more. And so there are a lot of things that we can do that positively impact patients that really don't have a significant downtime, significant recovery time, or significant long-term limitations.
Okay, so let's talk about what patients can expect. If they come to you, and will they get kind of a treatment plan? What is that integration into your business?
Right, right. So it all starts with a comprehensive evaluation. So we spend a lot of time with our patients on that first visit, getting an understanding of what their physical or psychological limitations are due to their pain, and work on it from there. That may involve having a patient start some physical therapy. It may involve a treatment plan that is just some medications. Very frequently, it's diagnostic or therapeutic injections or other minimally invasive techniques of treating chronic and cancer-related pain.
You say that your patients, too, have an active role in their treatment. They are very much involved. What does that mean to you, and what does that mean to your patients?
It means being educated, listening to what the options are, and asking questions. One of the things that's uncomfortable for me as an expert in this field is when patients completely defer to me and say, whatever you think is best for me, doc. And that's really the worst way to approach this. That's when patients will be most disappointed in the outcome because they played no role in the decision-making process and they didn't ask the questions. And I always tell patients, hey, if we're talking about a particular procedure, I want you to go home. I want you to Google it. Here are a few websites to use. Don't get crazy with it. But I want you to write down questions, and I want you to come in with that pad of paper that you wrote notes on. There is nothing on that you wrote that is too stupid or too infantile or not smart enough. I want every single one of your questions about this to be answered. So let's have another conversation.
Right. And Ron will also be a part of your treatment plan as well. He is always there to support you, moral support or physical.
Moral support,
whatever you
doesn't
need.
say much.
There you go. All right. You can go to ipscolumbus.com as well. And there's a lot of videos there, a great resource, I'm sure, for some of the treatments that you offer. And you can learn more. So Dr. Walega, thank you.
Thank you.